Hey, I'm Annette Pasternak, the Stop Skin Picking Coach, and I've got lots of good things coming up for you. I haven't done a video in a while, but that's because I've been hard at work on my new book, which hopefully will just be along in just a few more months. I also have group coaching starting soon. I'm starting to think about new dates for that. You'll find in the description below my website. You can go sign up on there to get notified. Sign up for the Freedom Kit, and that's where, I'll email right away when I know when the next group coaching is. I also offer individual coaching to stop skin picking and similar behaviors. And today I want to talk to you about this book that I read over the summer. I'm going to do, I think, a couple of videos on some really good books that I think will be useful to you guys. And this is the Period Repair Manual, Natural Treatment for Better Hormones and Better Periods. And this is also the revised and updated version, which I hear is better than the original version. So body-focused repetitive behaviors like skin picking, like hair pulling, and some others, they're actually the most common time when they begin to be a problem, when they begin to emerge, is around the time that women start menstruating, young women. It's been shown also that PMS does lead to increased of these behaviors sometimes. So it's really important to, if you can get a handle on issues like PMS and also, of course, other issues with your period, it not only helps your overall health, but it can really help with your picking or pulling or whatever. So the first main point of this book is that your period is a reflection of your underlying health. It should be relatively non-symptomatic. The author, Lara Bryden, is a naturopathic doctor. She makes a lot of good points based on science in this book, a lot of research, and her clinical experience as well. Her biggest, most important point is that hormonal birth control is not the answer to period problems. And hormonal birth control happens to be the #1 answer of medical doctors whenever you have a problem with your period. So, there's a lot of reasons why this is not ideal. It stops your hormones, first of all. It just completely shuts down your ovaries, and they don't make the natural estrogen, progesterone, and even testosterone. And those all have beneficial effects for us. When you take the pill, you might think, oh, but I'm still getting my period. Actually, no, this is not really your period. This is just a withdrawal from the drugs. So the drugs that you're getting on the other days are fluffing up, stimulating your uterine lining, and just when you stop taking the drugs, you just bleed. But it's actually not a real period, okay? And a real healthy period should be coming as a result of the hormonal cycle with ovulation in the middle of it. She goes into all the details, which is really good to know. I'm going to skip over. But when you have ovulation, then you get progesterone in the second part of the cycle, and then you bleed eventually. And you can be getting periods without ovulation. And obviously that's a big problem if you want to be fertile, if you want to conceive. Even if you don't want to conceive, it's actually, you're missing all the benefits of the progesterone, because if you do not ovulate, you do not get this surge in progesterone, which is really good for you. Progestin drugs that are in the pill are not the same as progesterone. They have some similar effects, but they also have some opposite effects, and you're not getting the benefits, and this can actually be really harmful. The so-called minor side effects actually are very common, and they include depression, loss of sex drive, hair loss, weight gain, sometimes acne, depending on which kind of pill. And the depression is particularly horrifying. This is a quote from the book. Anyone who treats women knows that hormonal birth control affects mood. The fact that it has remained unproven for 50 years is basically because no one was bothering to research it. So sexism rearing its head again. That all changed in October 2016. So this is very, very recent. Your doctor might not even know about this. That all changed in October 2016 when the prestigious medical journal JAMA Psychiatry released a groundbreaking study called Association of Hormonal Contraception with Depression. This study tracked 1 million women over 13 years and found that girls and women who use hormonal birth control are significantly more likely to be diagnosed with depression. That's one thing I definitely want you to know, really important, because also, depression, of course, horrible in and of itself, but it can also worsen skin picking. There's also problems in going off the pill. Okay, first of all, if you had a problem with your cycle before the pill doesn't fix anything, okay, and it can make some things worse. So after that, you probably go back to the same issues, plus possibly more. And some things that can happen post-pill, number one, are acne. So this typically peaks about 6 months after. So if you have gone off the pill or thinking about it, just know that, beyond the 6 months, it will start to improve. It should be fully resolved, fully improved within a year, she says. You can get post-pill PMS. You can get post-pill amenorrhea, where you're not getting your period for quite a while, and post-period PCOS, polycystic ovarian syndrome. So these are all things that can result, conditions that can result after you've stopped hormonal birth control. And the rest of this book is a guide to solving those type of problems, whether they've come from your birth control or whether you just have them and have not been on hormonal birth control or are not. What's really helpful in this book is she reviews a lot of different kinds of birth control and tells some of the more safer ones and the most beneficial. So before getting to the real details of each of these issues that people have with their periods and with their cycles in general, she does go over better birth control options. The best, for example, is the fertility awareness method based on your waking temperature. Sorry, I was reading my notes. So fertility awareness method based on your waking temperature. So you do have to take your temperature every morning and possibly some other observations depending which method you're using. And this has actually a perfect use failure rate of 0.6% when people are trained. 0.3% is the pills rate. So it's really very similar. Now, when we're talking about the typical failure rate for the fertility awareness method is 1.8%. Whereas with the pill, the typical failure rate, because people forget to take it or whatever, is 9%. So it's actually better. If you don't want to be trained, you can just use this Daisy fertility monitor, and that, if you take your temperature every day, typical failure rate is 0.7%. So it's really, really good. Or you can alternatively use these things to predict when you're fertile if you want to engage in sexual activity during those times. Otherwise, you avoid on those times or you use other methods of birth control. Okay, so again, you need ovulation to make progesterone, and that has all sorts of beneficial effects, including calming your nervous system, promoting sleep. And so both of those things are very important for people with skin picking or other body focused repetitive behaviors. Yeah, much less of these behaviors you probably noticed when you're sleeping well. Low progesterone, which again results when you're not ovulating, is associated with PCOS, heavy periods, fibroids, acne, PMS, hair loss, and perimenopause. So like I said, you may have non-ovulatory cycles where you're having your period but you're not ovulating. So you can, you can also use the temperature method to check for that, even if you don't need birth control. Estrogen excess is also common, and that will result in heavy periods, breast tenderness, PMS, and fibroids. And those are things, most of which, except the breast tenderness, are also symptoms of low progesterone. Okay, there's a balance between those hormones that's desirable. But the breast tenderness, notice that. Like if you do get that before your periods, that's a very bad sign, because excess estrogen, that's correlated to greater breast cancer risk, and it's just not a good thing. So one of the things you can do for that is liver detoxification, and that's that's covered here. We won't cover it. Some of the supplements I've talked about in other videos help with that. NAC, milk thistle, the broccoli sprouts, which I still am going to do a video on. All that can be helpful, as well as acupressure techniques. So this is what when I was over 10 years ago, I think I was having terrible PMS, including the breast tenderness and just horrible moods. And I used this acupressure that I still do today a little bit. Like I just do a few minutes each cycle. And so I'll share that book as well. I have an old video on that book that teaches you how to do that. Actually, I think I teach you in the video how to do the acupressure. Then Dr. Brian goes over all the different problems that can go wrong with your periods, whether you have heavy bleeding or even endometriosis, or, she really covers the gamut. I will skip that. And then part 2 is treatment. Okay, what to do for all these different issues. And that includes things like rest, sleep, exercise, removing foods that cause inflammation, the 5 most likely: sugar, alcohol, wheat, dairy, vegetable oil. She goes through those. I've long recommended to clients who have, either irregular periods, painful periods, a lot of increased PMS, or picking in the second half of their cycle, long recommended eliminating dairy to great effects. What I learned in this book is that the inflammatory culprit in the dairy is the protein called A1 casein, and it's actually not present in Jersey cows or in goat or sheep. So you can actually drink or have cheese from those different animals. Even just, butter or cream or ricotta cheese actually has very low A1 casein, even from the regular or more typical Holstein cows that we get dairy from. She warns that vegan diets or very low carb diets can be problematic, and she does recommend a list of supplements if you are a vegan. That would be helpful. And then finally, she's really got great recommendations for supplements here. I want to tell you just about a few because they seem to help everything. So number 1, magnesium. The miracle mineral for periods, she calls this. It gives fast results for PCOS, PMS, and period pain. And, this is something that I often suggest as well, because, it also reduces anxiety and it's helpful for sleep. And there's no need to test for magnesium if you're deficient. Just try it and see if you feel better, because most people are deficient and it's not going to harm you. With the exception, you don't want to take it long term if you have kidney disease, but other than that, it's supposed to be very safe. She recommends 300 milligrams magnesium glycinate, or there's a blend of different magnesiums that I like. I'll put in the notes below the video. Zinc is the number 2 supplement she recommends, especially this is important if you're vegetarian. I did a zinc video as well, so I'll link to that. Especially, I was emphasizing how important it is against acne and depression as well. So 30 milligrams zinc picolinate with or after food is what she's recommending. She talks about other supplements. Sometimes vitamin B6 is a common one, but these are the most common ones that people need. And, then there's specialty chapters on PCOS, PMS, loads of problems during your period. For example, fibroids, cysts, heavy or light periods. She's got all kinds of information and suggestions there. And then what happens in your 40s, that's interesting, and advanced troubleshooting. Now, I especially like her later section on how to talk to your doctor, because she gives a list of questions and statements that will help your doctor help you better. And I'll just read a couple of those to give you an idea. You know, your doctor has a lot of training in medicines, but those medicines, as we know, have so many side effects. You can get to like what's underlying the issue and use more natural things many times. She puts these how to talk to your doctor questions and statements in different categories. For example, no periods or irregular periods. There's a slew of questions, including, I'm vegetarian. Can you check my levels of iron, zinc, and vitamin B12? I feel quite anxious about food and I think I might have an eating disorder. Can you help me? Have I been screened for celiac disease? I've heard that can cause amenorrhea. Have I been tested for thyroid disease? What is my actual TSH reading? I've heard it should ideally be less than 3. So really specific, really helpful questions. There's a section you're told you have PCOS, what to ask. There's a section on hair loss. A section on you're being pressured to take hormonal birth control, because quite often if you have any issues, that's sort of like something doctors tend to just throw out. I remember actually when I was in my later 30s, exactly when I was telling you I had the bad PMS, I had some ovarian cysts, and that's exactly what they recommended. But I looked at the research and there was actually no evidence showing those were helpful at all. So I opted to get some acupuncture instead. This was right before I discovered the acupressure book. Somebody told me about that book. And so that helped. They went away with that. And once I started doing the acupressure, that totally made my cycles normal. And they still are, which is amazing. That was like over 10 years ago. I still do that little bit of acupressure every month. Hormonal birth control, lots of questions there. I'll just read a couple. My periods were fine before I went on the pill. I understand it might take time to get my periods back. I'd like to give it a few more months. Are you saying I need the pill for my bone health? I understand that the new research says the pill doesn't actually help with bones. Some examples. There's a section, your doctor is skeptical of the fertility awareness method. They might think it's like the old rhythm method, which is not, where you discover you're not ovulating. There's questions. She's got loads of questions for heavy periods, what to ask for pelvic pain. You're going to have surgery for endometriosis, for perimenopausal mood symptoms. And then the last section, how long will it take to see results? The coolest thing is that PMS can improve in days or weeks with magnesium and vitamin B6. And normal period pain should improve within the very first month as you remove dairy and take zinc. And I've seen people just improve just from removing dairy. That I notice a fluctuation there with my own. You know, if I have a lot of dairy, I tend to get a lot of period pain. If I don't have any, I don't. Okay, post-pill acne, like we were saying. So anyway, I highly recommend this book. There's just so many nuggets in here. I just kind of did a review of what I thought some of the most important things for you all might be. Please share what experiences you've had in the comments, or if you've read any good books or seen any good resources around this issue. I think we'd love to, and we need to learn more. We need to kind of take our health back in this area.